exclude actually the symptoms related to the common medications. For example, the patient is taking prednisone or quinine, different combinations of quinine, or methotrexate, for example. These the medications has their own side effects. So you should know the side effects of the medications to exclude them, to prove them in the case. And if a case is suffering from some maintaining causes, honeymoon cause those influences that comes from environments, that if you cut the source of that influences, the symptoms disappear, maintaining causes. For example, air pollution. Air pollution is something, if someone who lives in a city with severe air pollution suffers from some kind of maintaining cause and suffers from, for example, some respiratory symptoms. Can you cure them with homeopathy? Or you should move the patient to a better area with good air. Of course, maintaining process may cause some kind of effects, but this is not the cure. This is not the solution for making the patient better. You should exclude the carbon monoxide, for example. So you should understand different factors, different vectors in the analysis of chronic patients. Let's see the next slide. You have laser pointer. When a chronic disease feature is formed, it is actually the combination of different chronic patterns. Different chronic patterns for a chronic disease. Now I will go through the examples so you can get the concept. Reactive chronic patterns are not those that animal cause maintaining causes. There is a presence of a maintaining cause. There is a factor in the environment that affects the patient, affects the person. They can be physical or chemical or psychological. For example, a person suffering from bad position, bad ergonomy, bad position while sitting at the desk, long back sitting. This is a physical maintaining cause. You cannot cure that patient, for example, with agaricus, with rhizodendron, or for example, with bryonia. The patient should correct the position of sitting at the desk. So this is actually a physical maintaining cause. Chemical maintaining causes are toxicities, poisoning. For example, the drinking water has a high concentration of arsenic. There was a village a part of Iran that many patients showed symptoms like an epidemic. But there was no epidemic actually. They were drinking large doses of arsenic tetroxide, like the sauce that we make arsenicum algal from it. So if you prescribe the remedy for them, there is no result because they're taking arsenic. You know, there is an aphorism in the animals organ that you cannot cure poisoning with the remedy, and you should prescribe according to the constitutional or the heat remedy to help patients to actually detoxify themselves. And what about psychological maintaining causes? Can you give me an example of psychological maintaining cause? Can you? Yeah. Give me an example. Stress. Emotional stress. Yeah, we have two kinds. Actually we can consider emotional states in dynamic chronic patterns too. Because when one is affected by severe grief and he is actually trapped in the grief, he may be in a dynamic chronic pattern. But for example, considering that a woman is living with an abusive husband. I had a patient with having a husband with actually very abusive behavior, very abusive behavior. If you, for example, prescribe a statistic for such a patient, can you solve the condition? Or you need to cure the husband also? Or maybe the patient needs divorce to become cured. There are some psychological or chronic patterns. So during the case taking, you should understand about the environment of the patient, the atmosphere where the patient lives in. Second category is static chronic patterns. The static chronic patterns are those symptoms covers those symptoms that reflect the irreversible defects. For example, you see some dysfunctions after physical trauma. After car accidents, there is a cut in the nerve, and you feel numbness or inactivity, motor inactivity in the patient. You cannot cure that with homeopathy. You cannot consider the symptom. Maybe by treatment of the deep constitution of the patient, or considering the miasmatic rhythm of the patient, you can increase the healing power of the patient to somehow regenerate the defects. But you cannot consider those symptoms that are related to the trauma and directly go to the repertory to find suitable remedies. These are irreversible defects. There are three kinds of irreversible defects. One is traumatic defect that I told you. One is the sequelae of a severe or prolonged dynamic pressure. For example, some types of hypothyroidism are autoimmune, and if you measure the level of antibody anti-TPO in the blood is very high. Not all of the hypothyroidism patients are autoimmune. Some are iodine deficient. Some are genetically prone to hypothyroidism. Those that are autoimmune, after a long time of destruction, auto-destruction of thyroid gland, you see hypothyroidism. This is actually trauma. A trauma is resulted of a destruction, an auto-destruction in the body. So you see the symptoms of hypothyroidism. You see the symptoms of fatigue. You see the symptoms of, for example, dryness of skin, lethargy, feeling of chilliness, depression, lack of motivation. These are all symptoms of hypothyroidism. But in such a case, you cannot take those symptoms and translate them to the repertory directly. This is the result of the destruction. What we should consider is curing the autoimmune dynamism. If we think deeply and cure the autoimmune disorder deep in the patient, then maybe there is a time, there is an opportunity for the normal thyroid gland to regenerate. Because in thyroid gland, there is a possibility for regeneration, for making new tissue, new thyroid tissue. But this is not the case in many static conditions following the dynamic stresses. For example, in the Parkinson's disease. What is the case in Parkinson's disease? Can anybody tell me? Regarding this condition, whether the severe or prolonged dynamic pressure.